Hello, everyone, and welcome back to the Beat podcast, recorded live here at Health. I'm excited to be hosting today's episode with Trudy McKanna. She's the Senior Field Medical Director at GRAIL. She's a seasoned professional in the field of genetic counseling and medical affairs, and she's just an incredible person that's going to tell us more about what she and the GRAIL team are up to. Thank you for joining us.
Thanks, Al. Pleasure to be here.
So tell me a little bit more about what you're up to in your role there at GRAIL.
So I'm the Senior Field Medical Director, and what that means is I run a number of different medical-facing divisions within GRAIL. The primary division would be our Medical Science Liaison team, and that team works part and parcel with our sales team. So when the sales team is going out and getting new business, what we really want to do is increase education and awareness of this technology, because it can be a little bit complicated. We are seeing some things that are changing, some cancer screening paradigms. There's a lot of questions. And so my team really is that wraparound service to make sure that a physician is very comfortable with what they're now going to be offering to their patients.
Totally. Yeah, that education piece is so critical. Tell us about GRAIL and the Galleri multi-cancer early detection test.
Yeah, so GRAIL is a healthcare company focused on one mission: to detect cancer early when it can be cured. Now, it's a pretty lofty mission, but we have a flagship product called Galleri Multi-Cancer Early Detection, or from now on we can just call it MCED, if that makes it easier for everybody. And this Galleri test uses advanced sequencing and machine learning to look for cancer signals in the bloodstream. And what it's doing is it's a prescription blood test that looks for this shared cancer signal across many cancers, dozens of which don't have any routine screening today. So if you look at cancers that we have available screening for, it's only about 30% of those that actually cause death by cancer. So 70% of cancer deaths are caused by cancers that we are not currently able to screen for. Galleri is a test that solves that unmet need by screening for multiple cancers at one time.
And is this the type of test where it takes a look at cell breakdown?
Yeah, so it's actually combining two types of technology: cell-free DNA, which is, I think, what you're saying with cell breakdown. Yep. So everybody's cells, when they die, they explode like confetti. I describe it, and all that DNA in your body just are floating all around. So everybody has healthy cell-free DNA in your blood. You can also have unhealthy cell-free DNA in your blood coming from a cancer cell. And that cancer cell is going to have different, what we call methylation patterns. So that's just different ways that the genes in the cell are turned on and off. So what we're actually looking for, that shared cancer signal that I mentioned, is looking at different methylation patterns. We don't want to find a methylation pattern that is consistent with a cancer cell in your blood. But if we do, that's our first signal that, hey, there might be something going on here that we need to look at a little bit more closely.
Got it. Thank you for explaining that. And so early detection's huge, right? How does it help? And can you share any statistics?
Yeah, so if we take a look at it from maybe a health economics perspective first, our health economics team did some research on covered lives with commercial insurance, about 6 million patients, to understand the impact of late cancer diagnosis on a typical employer population. What we found was that more than 1 in 3 members with cancer over the age of 50 aren't diagnosed until the disease has metastasized or spread throughout the body. And this is pretty common because early stage cancer, sometimes you have no symptoms, and it's not until that disease metastasized that you end up going to the doctor for some type of symptom and get diagnosed with late stage cancer. If you look at, say, pancreatic cancer, for example, 57% of pancreatic cancer patients are diagnosed stage 4, 61% if you're looking at stomach cancer. And these are aggressive, deadly cancers. Yeah. If you think about, too, why that's so important, the 5-year survival rate for metastatic cancer is just 21%. So it's almost 4 times that if you can catch that before it's spread. We also look at, what does that mean? And we look at model data to say that if you start adding Galleri to regular cancer screening, so we're talking mammograms, colonoscopy, et cetera, you could reduce the amount of stage 3 and 4 cancers by as high as 50%, which then translates into a 5-year cancer-related mortality reduction of 26%. So that's how many lives we could be theoretically saving in this model data.
That's a big number.
It's a huge number. Not to mention also the cost of treating a stage 4 cancer versus, and not just the financial cost, the healthcare system, but the indirect cost, the cost to the patient, the cost of the caregiver, the family, time off work, et cetera. Completely different story if you have a stage 1 local disease versus a stage 4 metastatic situation.
And so this Galleri multi-cancer early detection test, 50 plus cancers before any symptoms appear. How does that work?
Yeah, so I mentioned a little bit before about the marriage of the cell-free DNA and the methylation. So it's a simple blood draw. That's first and foremost. And it's looking for that shared cancer signal that we see in cancer. And if we see that, the next step that the methylation allows us to do, that technology, is to pinpoint where in the body it looks like that cancer signal is coming from. So if we do see a cancer signal, they'll get a result back that says, this is where we think it's coming from in the body. So it actually directs the provider where to focus their efforts so that they have a very efficient, expedited workup to say, is this actually a true cancer signal?
Well, that's fascinating. And then how do you zero into the part of the body or the type?
So I mentioned methylation is the technology that turns genes on and off. So it tells, and so from the very beginning, when an embryo is forming, methylation is what's telling a heart cell to become a heart cell, or a lung cell to become a lung cell. And those methylation patterns are still present in your body right now. So we look for that methylation pattern that's consistent with cancer. But then on top of that, we look for the methylation pattern to say, is this consistent with a lung cell, a pancreatic cell?
Cool.
So it's actually that second piece of it. So it's really phenomenal that methylation technology can do both pieces of that analysis.
Powerful.
Yeah.
Yeah, that's so fascinating. If somebody out there there's a huge movement for wellness and longevity. So if somebody wanted to take this, can you just buy it online and do it if you want to direct to consumer, or do you need a prescription?
Not direct to consumer. It is a prescription-only test. It's designed for asymptomatic individuals at increased risk for cancer. So how we define that at GRAIL right now is individuals 50 or older. Unfortunately, can't do anything about it. Age is the number one risk factor for cancer. Individuals over the age of 50 have 13 times higher incidence of cancer than people under 50. So as soon as you're 50, or we also know that there's a lot of people under 50 who have other risk factors, family history, they've been a cancer survivor themselves. There's lots of other things that may put them at an increased risk. So these are the individuals that we want to screen before they're symptomatic on a routine basis so that we can get that additional information.
Got it. Yeah, really good to know. How's your organization reimagining care delivery to improve both access and outcomes, especially for historically underserved populations?
Yeah, so at GRAIL, we're reimagining cancer care by moving detection earlier and bringing access closer, especially for historically disadvantaged communities. So first, access. Because Galleri is a simple blood test, it helps us meet people where they are. Primary care clinics, mobile phlebotomy, employer sites. So this flexibility matters if you're in a rural community, shift workers, where it's just maybe not as easy to get access to healthcare. Because this is such a simple way to do this screening, we've removed a lot of those barriers. Again, we don't want to replace standard screening, but for some people, if they don't even have access to mammography, colonoscopy, et cetera, this can help them at least have access to some kind of screening. Secondly, regarding outcomes, care delivery is different. Like we talked about before, a stage 1 treatment plan is very different from a stage 4 treatment plan, both for the patient, cost of the healthcare system, et cetera. And then third, thinking about equity by design. Right now, this is not covered by most insurance companies. It's covered by a few. And so we want to be able to make sure that when reimbursement is in play, that we are ready to go, to make sure that this has broad access, that we can scale this to population so that nobody is left behind in this cancer screening. So coding and billing readiness, payer partnerships, clear clinical pathways, bilingual patient education, patient navigation, all of those wraparound services that you want to have in place before so that we're ready to go.
Fantastic. Well, there's definitely a pathway for that, for both access and outcomes. With so many emerging technologies here, we see them all over the conference. We're hearing about them in the news. They're everywhere. How do you decide which innovations to invest in, and how do you measure their real-world impact?
Yeah, we've been talking a lot about that this week, both at this conference and just with some of the new developments that I'll talk about in a second from our company. I mentioned population health level. We want to be able to scale what we're doing. We want to be able to provide robust data to show that how this performs at a population-based level. This is a huge investment. You'd want to make sure that it performs the way you expect it to, that we can scale it across primary care, community settings, underserved populations. And while we're looking at that, when you're scaling it and you're considering impact, it's also important to examine published peer-reviewed clinical data for clinical validity. How is this test performing in that intended use population? So I described that before. People at increased risk for cancer, such as those 50 and older. In that intended use population, what do we expect to see? How many positives do we expect to see? If you get a positive, how likely is it that's going to be a true positive? So you want to be able to look at labs that have all of this data in a peer-reviewed format. So this past weekend, for example, we were really excited to present our largest interventional studies, some initial study findings at the European Society of Medical Oncology, or ESMO. And it was the first 25,000 patients of a 35,000 patient study who've had the Galleri test. And we found that when you add Galleri to standard of care screening, 7 times more cancers were detected. So that's just a phenomenal amount. If you're talking about detecting cancers that you wouldn't have otherwise, but you want to be able to prove that with your studies. We also found that over half of them, 54% of them, were found at early stages. So again, we're meeting that unmet need in what we're doing, and we have the clinical validation in the studies to prove it.
That's phenomenal. 7x more findings, and of those 50% early stages, talk about preventative care.
Yeah.
Brilliant.
Yeah, and the other thing I'll add is the false positive rate in this study was 0.4%. So that means that less than 1 in 200 people would get a false positive result. And I know that's oftentimes a concern. If we have a technology that we want to scale, you can't have a lot of people getting positive results and going through getting workup. But a 0.4% false positive rate is the lowest on the market. It really speaks to this is applicable and scalable at a population level.
In a big way. Trudy, this has been super insightful. I really thank you for coming and sharing these insights that GRAIL is up to, that you're up to. People want to learn more. Where can they go?
I would direct you to www.galleri, that's GALLERI.com.
Amazing. Galleri.com. Check out the show notes, folks. That's where you're going to find it. It's been such a pleasure to host Trudy McKanna, Senior Field Medical Director for GRAIL here at the Beat Podcast at Health. Trudy, thanks for joining us.
Thank you so much, Sal.